subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us a really well-known doctor, Dr. Jatin Kothari, who is a leading nephrologist. And it gives me great pleasure to have him here today as we complete 2 years of Health Live at Seniors Today. This is 2 years of Health Live at Seniors Today. We've been at it every Saturday at 5 p.m. And today we have Dr. Kothari, who is going to be talking about chronic kidney diseases in senior citizens. A little about Dr. Kothari. He is Director of Nephrology and a Chief Consultant Renal Transplant Medicine at the Nanavati Max Super Speciality Hospital in Mumbai. Sorry about this. He's a DM in Nephrology and MD in Medicine from Bombay University, following his MBBS also from Mumbai. He's done a clinical fellowship in nephrology and transplantation from the University of Toronto. He is a visiting ISPD scientist at the University of Missouri Health Sciences at Columbia in the US, and International Society of Nephrology Education Ambassador. He has done his the ISN Global Outreach Program, the International Transplant Observership at the Massachusetts General Hospital in the US, and the Roche Preceptorship in kidney transplantation from the University of Alabama in the US. He has an ISN-ANIO fellowship in Nephropathology and Preceptorship in kidney transplantation at the University of Toulouse in France. Dr. Kothari is a former General Secretary of the Zonal Transplantation Coordination Committee of Maharashtra from 2010 to 2016, a fellow of the International Society of Nephrology. He's a postgraduate teacher for GNB Nephrology since 2006 at the Hinduja Hospital. Now, in the last 2 years, we've had several doctors, as you all know, but today, Dr. Kothari's profile interests me more, and I'm going to speak to him at some time on this, is because he has done a transformational leadership course for healthcare management from the International School of Business, that is the very respected ISB in Hyderabad, a certificate course on entrepreneurship in emerging economies from Harvard X, which is the online initiative of the renowned Harvard University, and he is currently pursuing his PhD in social entrepreneurship from the TISS, that is the Tata Institute of Social Sciences. Welcome to Health Live at Seniors Today, Dr. Kothari. How are you?
Thank you, Mr. Maheshwari. It's a pleasure to interact with you, and in the next few minutes, we'll take this topic of chronic kidney disease and its importance in the elderly population. I wouldn't say the elderly population, I would say the growing young population of India. And let's address this issue, which is also of pandemic proportions in our country. So thank you very much.
Thank you, Dr. Kothari. I must first speak to you about a question which a host of people have over here. There are some people who are connected. There are some people who are watching it on YouTube or Twitter or Facebook, and they would all want to know as to what is the situation of the pandemic right now, because there are issues about numbers rising. It is still under 1,000, but there have been some advisories about wearing a mask, etc. So, what is the reality on the ground as of today?
Sure. We have to start and probably end with the COVID pandemic in all talks that we give over the last 2 years. So just a little update. Yes, the last few days, we have seen a slight rise in the number of cases. Thankfully, compared to the previous waves, this time we are seeing much more milder illness. Most people are able to manage the illness at home. Very few hospitalizations and very few ICU admissions. So that's the, I think, the sort of light at the end of the tunnel. I hope it's the end of the tunnel of COVID that we are seeing in India at least. But yes, there are some general precautions that we all have to follow. And the only reason why I'm not wearing a mask right now is because I'm in an isolated room. But for all people who are out there, yes, it is important and imperative that all of us continue to wear the N95 masks, especially in crowded places, because you never know whether somebody next to you is probably having asymptomatic COVID, even asymptomatic COVID. So there is a chance that you can pick up COVID. Despite having the vaccines and the booster, there have been a slight increase in the number of cases. So we all need to continue to have all the basic things like social distancing and wearing a mask and maintaining some sort of a social distance in crowded places, which is still required. So obviously hand hygiene and all that, which has been stressed upon over the last 2 years, all that needs to continue. And hopefully we are seeing, this turning out to be more like a viral illness was what we are used to every year, maybe in the flu season around October, November every year. So even COVID likely is going to behave in the same fashion, but we do need to take some precautions.
Doctor, I have one more question on COVID. Now, one of the things which is happening is that fine, I might wear a mask, but the world around me is not masked up. And you might take an Uber or a taxi or a rickshaw, and you may hand over the mask to the person. But how can you do that with the rest of the world? So, what, according to you, medically, is the advice to the people who are here?
So I think basically still avoiding social functions and gatherings wherever possible, and that's probably one of the reasons why you're still continuing to do the programs on the web, is something that is advisable because the disease is still not gone away, and people with comorbidities, especially in this age group of more than 65, they still need to maintain some discipline to keep the COVID virus away. My only recommendation is that the only thing that has helped us to reach at this stage is the vaccine. And if somebody is not vaccinated, my earnest request would be that if you are vaccinated, then at least the chance of you giving the virus to somebody else also is much less. And it, of course, protects you yourself from the COVID. So that's something that you need to keep in mind. And mask is a good idea. I know some people feel very uncomfortable wearing the mask all the time. But even when you are in a crowded place or in a public place, at least try and ensure that the mask is on and not, below your chin, because the protection is still required to protect yourself as well as to all people around you.
Now, Doctor, while I was speaking with you and I was introducing you, I coughed. Yeah. Now, if I do find somebody, if I'm in a scenario where there's somebody who's next to me is coughing like the way I did, is there a reason for me to be worried?
Most likely the cough is not due to the COVID. If you've been vaccinated, then I would expect that your chance of having COVID is less than 0.0001%. But at the same time, yes, taking precautions is always better, as we have seen how much this disease has caused mayhem all across the world. So being a little careful, taking an extra precaution, I think is wise in the current day and age, where we are seeing a few more cases than what we were seeing 2 months back. So yes, taking precautions is still mandatory according to me. And
Doctor, on a lighter note, what do you do? How do you, in times like these, how do you spend an evening out? Do you go to a theater? Do you go for a movie? Or do you go to the beach? What do you do? How do you manage in these times?
Yeah, so life has come back to almost normal, I would say. So there is some travel around here and there, and life has become near normal, I would say. But I would still avoid public gatherings, and most of our medical meetings also, we still have a limit of the number of people who can attend, etc. So there are some precautions, and obviously we are at a slightly higher risk because being in the healthcare, where we are seeing so many people every day and day in out with comorbidities. So we have to be a little bit more careful. But I would say that overall life has come back to 95% normal as of now. So yeah, that's reasonable looking at comparing what we were in sort of April 2020.
Absolutely, Doctor. It was a nightmare. Well, Doctor, we've spoken a fair bit about COVID, but it was necessary for me to do that. The last few sessions of this of Health Live, we had almost eliminated this introductory question, but as it happens, so over to you. A few opening remarks about the entire discussion about chronic kidney ailments for seniors, and then
Sure.
we will have questions from the audience. As always, please put them in the Q&A tab if you can, and mention your age and gender so that Dr. Kothari could give a considered reply. And obviously we will not be able to name medicines, etc. But if you do have a query, please post them over here, and we will address it to Dr. Kothari. Over to you, Doctor.
Sure. Okay, thank you again, and welcome to the session. I assure you that I will not bore you to, on a Saturday evening with too much knowledge, but giving you some basic tips about kidney disease and how we need to handle this, if at all it happens. Some tips about preventing kidney disease, which is, I think, most important in this population of more than 65. I don't call them 65-year-old. I call them 65-year-plus young people, who can maintain health and prevent, kidney disease in some circumstances. And also talk a little bit about how life can be normal, even if you end up having a kidney problem, how you can tackle it in the best way possible, have a reasonably good quality of life, even if you are on dialysis or if you are looking for some kidney treatment. So let's start with the basic understanding of what happens to kidney function with age. So I think a lot of people still, misunderstand when we label somebody having kidney disease as to how we label them as having kidney disease. So there are basically two important and very basic tests that we carry out in anybody whom we suspect having kidney disease. One is called as a blood test, which is called serum creatinine, which gives us an estimate of the creatinine level in the blood, which indirectly indicates how much a kidney is working in a given person. Most of us are born with two kidneys. There are people who are born with one kidney who have a normal lifespan up to 95 years of age. So unless and until you do a sonography and check whether you've got one kidney or two kidneys, you would not come to know, because even with one functioning kidney, we can have a normal life moving forward. And that's the reason why we encourage a lot of living donors to donate one of their kidneys if their loved ones or family members need it. And it's absolutely safe to donate one of your kidneys if your other kidney is normal. So that's one key message that I want to give to the people who are attending this session, that God has probably given us one kidney just to as in spare to give it to somebody who needs it. And if your family member needs it, yeah, you can easily go ahead and give the kidney. The second test that we commonly do in this patient population is a simple test called as a urine analysis. And if you go to any laboratory and just ask for a random urine test, it will probably cost you about 100 rupees, but it will give us a lot of information in terms of whether you have any early signs of kidney disease, and that could be picked up by just checking the protein level in the urine. So the lab will just process your urine sample and tell you whether your urine contains any protein traces or not. If there is some protein leakage in the urine, then yes, sometimes we are able to detect a kidney problem and then treat it appropriately and in a timely fashion to prevent further kidney issues. So my recommendation to all the people who are attending this function is that beyond the age of 50, it is advisable that you do these two simple tests. One is called as a serum creatinine, and the second one is called as a urine analysis. Just go to any laboratory of your choice and just get this done once a year. It will probably cost you not more than 200 rupees to get these two tests done. And this will give you a fair idea about how your kidney function is. The reason I say that people above the age of 50 should start doing this test is because normally, even with somebody who's got normal kidneys, beyond the age of 40, the kidney function normally goes down by 1% every year. So what I'm trying to say is that once you age from the age of 40 and reach 80, so that's 40 years beyond 40, your kidney function normally, which is 100%, will drop to about 60% by the age of 80 by itself, even without any disease, without any risk factor for kidney disease. So that's the reason why in the elderly population, and it's got a lot of reasons. Obviously, the kidneys also age as we age. And there are some changes that happen in the kidney filters and the kidney vasculature, etc., which lead to decrease in the kidney function over a period of time. So that's the reason why we need to be a little bit more careful in this age where we are dealing with people who have kidney disease, and you need to keep a watch on the kidney by doing these two simple tests. Let's look at some of the other aspects of what common kidney problems you can have beyond the age of 65. So most of you would be aware that the incidence of chronic kidney disease, or what we talk about as commonly said as kidney failure, and it could be one of the stages, it is staged from stage 1 to stage 5. So the incidence of chronic kidney disease over the last 30 years in India and all across the world has been increasing at pandemic proportions. And the two most common reasons for kidney disease or kidney failure in our country and all across the world is diabetes, which is high blood sugar, and second is hypertension, which is high blood pressure. So diabetes and hypertension account for almost 60% of the total kidney patients that I see in my clinic, and worldwide in statistics it is seen that diabetes and hypertension are the two commonest causes why people end up having kidney failure, or require dialysis, or require a kidney transplant. So as we age, we know that these metabolic complications like diabetes and hypertension are much, much more common in the age group that we are talking about. And these two risk factors are the common reasons as to why kidney function deteriorates. So if we are able to control diabetes and blood pressure to a good extent and prevent further complications of diabetes and hypertension, we'll be able to reduce the incidence of chronic kidney disease in India. What about other causes and specific causes in this age population? We deal with a lot of patients, especially the male patients who have recurrent urine infections because of prostate issues. I'm sure, Mr. Maheshwari was telling me that Dr. Percy Chipper had taken a session with the audience a few weeks back, talking, and I'm sure he's talked about the prostate issues that male patients in this age group deal with. And sometimes if the prostate problem is not detected in time, then you can end up having recurrent kidney infections and urine infections, which could lead to occurrence of chronic kidney disease. So that's something that we need to be aware of and be detected early. And again, testing for the prostate is very simple. You just have to get a sonography done for the prostate gland, and this is only applicable to male patients. That you get a sonography and do a test called PSA, which can be done on the advice of any treating physician. And these two tests will give you a rough idea about what is going on with the prostate. In female patients at this age group, we usually deal with some uterine problems, some problems with incontinence of urine, where female patients cannot control their urine, and there is a higher incidence of urine infection because of some local infection in the urinary tract. So that's something that we face quite often, and it's a very challenging thing to treat. There are very limited options in terms of treatment. So if we can prevent it by doing good lower body exercises and pelvic muscle exercises, especially the female patients who have a lax abdomen, they should be doing some exercise to keep the muscle tone good so that they can have better control of their urine with the bladder function and prevent urine infections, because again, these urine infections can sometimes lead to very troublesome kidney problems, even to the extent of going on to CKD stage 5 and require dialysis. So something particular for this age group, prostate problems in men and recurrent urine infections in women is what we need to be aware of. And hopefully we can prevent these things from happening by doing regular testing and going to a general practitioner or a physician to just get evaluated if there are any symptoms which point towards a urine infection. In this audience, I would also want to say that, quality of life is something which is very important for all people beyond the age of 65. It's just not that you're retired and you're going to have a very sedentary life. People can still remain active. And when I put my, elderly patients on dialysis, sometimes they come to us very late and they require dialysis for life support. They have to continue dialysis 3 times a week. So I tell them that don't get disheartened, because even life on dialysis can still be close to normal you are free to travel. Even if you are doing dialysis, say 3 days a week, we can make some arrangements for you to travel to various places in India, and there are dialysis centers practically in every nook and corner of the country now. So you could definitely take a vacation for a week, and we can arrange your holiday dialysis if that is required, wherever you go. So that allows you to have a near normal life. I have a lot of patients who travel abroad where where we help them make the arrangements for dialysis. They're visiting family, they're visiting, all sorts of places. They go on cruise, and there are a few cruise liners which have dialysis machines on board. So we try and help them to cope with this disease, even with difficult treatments like dialysis, to ensure that their quality of life doesn't get affected. Some common things which all elderly people need to know about is that if you have advanced kidney disease and if you end up, going on dialysis, don't get disheartened, because now the overall success of dialysis is very, very good. We have people who survive more than 10, 12, 15 years on dialysis. If they do proper treatment and take proper advice from the nephrologist, then they can have a near normal life even on dialysis. Sometimes when we look at patients requiring a kidney transplant, we don't discourage them just on the basis of age. So as long as their heart function is good, and if they are otherwise physically well, then even at the age of 70 or 75, we still encourage them to go and look for a kidney donor from the family and do a transplant, because your life can come back to almost normal with a functioning kidney, which is a kidney transplant. And if you don't have the access to any organ donor in the family, or if you are waitlisted for a long time for getting a kidney from somebody who's brain dead, then yes, definitely you would have to be on dialysis for a few years. But life goes on. Even on good quality dialysis, you can have a very, very good outcome, and life can remain as close to normal. So talking about overall other tips for preventing kidney disease, I know that our lifestyles have become so fast that we are always on the move, and we want to be very active. And sometimes beyond the age of 75, 80, there are some musculoskeletal problems which patients face. And in those situations, we still want to continue to do whatever we want. And, we pop painkillers and take medications without advice from a physician. That's something that I would strongly dissuade from doing, because one of the common reasons of kidney failure in our country and all across the world is drug-induced kidney disease. When I say drug-induced kidney disease, it means the kidney function gets affected because of the unnecessary medications that you take, especially drugs like painkillers. A lot of people take Ayurvedic medicines for general health and well-being. So all these alternative medicines, which are not properly scientifically studied and not prescribed by a proper registered physician, can also lead to unnecessary kidney problems, and which increases the burden of disease in this population. So we need to be a little careful about intake of all these medications, and always take the advice of your treating doctor, someone who's a family doctor or a physician, who can guide you whether these medications are needed actually, or even if they are needed, how much long you should be taking them. Just don't keep on perpetually taking these medicines, because they can sometimes lead to a lot of problems. Some questions which commonly are asked, and we'll wait for some of the questions from the audience, but some questions which are commonly asked to me in almost every seminar that I take is, what is the normal amount of water intake that I should be consuming, especially at the age of 75? If my physical activity is not that much, what is the normal amount of water intake that I need to take to keep my kidneys healthy? My standard answer to that is take up to 6 to 8 glasses of water. That's about 2 liters of water in a day. I think that is more or less sufficient for every normal person in this age group. If you have an underlying heart condition or a kidney condition, obviously your fluid intake will be guided by your dietitian and by your treating physician, who will guide you whether you really require to take excess water or not. Sometimes we have to restrict water intake if there are problems with the heart or kidney function. So, but more or less, most patients can take water intake of up to 2 liters per day. What about other things like alcohol, etc.? We strongly urge, all the senior citizens to avoid frequent alcohol consumption, and staying away from alcohol will help you to reduce the burden of or the chance of kidney disease occurring in you yourself. So that's something that we can always try and do to prevent kidney disease. About smoking, absolutely, smoking should be strongly condemned. Anybody who's smoking at any age, be it a young person or an elderly person, smoking is a big risk factor for kidney disease. It is a risk factor for a lot of cancers, as most of you would be aware. So complete no to smoking, and alcohol consumption in moderate quantity, and obviously regulated and under the purview of some person who's going to monitor your kidney and your liver function from time to time, is also something which is very important. So overall, in the last 10 minutes, what I have covered for all who are attending this session is that the importance of kidney function, the importance of living a normal life, even with kidney disease, what are the common risk factors for kidney disease, how we can prevent kidney disease, and some common things that you can look out for in terms of trying to detect kidney disease early and seek the right advice at the right time to prevent occurrence of severe kidney disease in this age group. So I think I will end here, Mr. Maheshwari, and I would be happy to take any questions or comments from the audience. Thank you very much.
Right. Thank you, Doctor. I think you've been, it's been very detailed and very well explained. We have a few questions already in. There was a question from Mr. Jatin Kothari. Now, this is something that we've raised in the past, and it doesn't concern your subject, but his assertion is that family doctor is gradually disappearing term because most doctors are becoming specialized in narrower and narrower medical branches. We hardly find a GP these days. What is the solution? Now, Doctor, I think it does concern you also, because where does one go if one finds that there is a problem? You can't, everybody can't be coming to you, a specialist first time. Correct. So who does one go to when you have a problem? Because I can tell you something from my own experience, Doctor. For the last 15 odd years, I have not had a family doctor, so to say. And for the first 40 years in my life, I've had one. So what does one do?
Yeah, I agree. I think this is a wonderful question in the current day and age. And I would only say that usually our family doctor nowadays is google.com. So, the first thing that we do is, if something is wrong, we'll just check it up on Google. And that's a major problem. I would say that sometimes, Google gives such misinformation, and that's obviously uncontrolled information most of the time. So I would strongly discourage you from doing that. Suffice to say that family doctors and family physicians is a rare commodity, especially in metro cities like Mumbai and Delhi and Bangalore. You will find it difficult to find a family doctor. But there are still enough family doctors around, and for basic things, simple things, it is still advisable that you go to your family doctor who knows your history and probably your background, etc., and he'll be the right person to guide you. There are a few family doctor chains that are all available all across Mumbai, and if you put family doctor in a particular area, say you put family doctor in Walkeshwar, you will see some names come up on the internet, and it would be advisable that you seek advice from somebody who is nearby. So that would still be the right way to go about. Suffice to say that all areas in Mumbai, there are good hospitals, and most hospitals will have very good general physicians who look after, things like health checkups and, routine checkups for everyone who's beyond the age of 50. So I would encourage most of you, to have an annual health checkup, if not every year, at least every 2 years. And in the health checkup package itself, there will be a visit to the physician, which is included in most health packages that I have seen across the city. So it is definitely advisable to do a good health checkup every 2 years and just detect any problem, if at all there is anything. and that will show up. And then the same physician can guide you. If you have a kidney issue, yes, they will send you to a nephrologist. If you have a prostate issue, they will send you to a urologist, and blah blah. So essentially, you can still take advantage of the physician who's a part of the health package at most hospitals across the city.
Right. Thank you, Doctor. There's a question from Mr. Sumir Chand, who's 80, and his question is: I have started having burning sensation during urination. Earlier, whenever I used to face the situation, I have been taking Citralca once or twice, it would subside. Is this an indicator of something serious? What could it be? And he has added that he has no diabetes and blood pressure.
So usually if you have urine problems at this age, I would say 95% of the times at the age of 80, it would be related to something with the prostate. So yes, the prostate enlargement could be a reason why you are having increased frequency. If you have significant burning, then it does indicate that there is a possibility of urine infection. And again, the urine infection could be because of the underlying prostate problem. So yes, you would require to go and see a urologist, and the urologist can be someone who can see you on an outpatient basis and advise you a couple of tests. We've already discussed a part of it in the talk, that you can do a simple sonography and do a blood test called PSA, and go to the urologist with these two tests, and he'll be able to guide you if at all there is a possibility of urine infection, or if there is a prostate problem, and what would be the further line of treatment based on his assessment. So something that needs to be looked after for sure. Burning in urine is not a common symptom. Taking Citralca will help you to reduce the burning in the urine, but it will not cure you of the problem. So it is still advisable that you seek a urologist opinion with the test that I mentioned.
Thank you. We have a question from Usha Jacob, who's asking a question for a 74-year-old male. Is it advisable to drink water only if you feel thirsty? And she's added, ideally we say eat food only after feeling hungry. Is it the same with drinking water? Sometimes we drink water just because everyone says, I mean, we're not really thirsty. So what is the medical view?
So thirst is a very relative thing, and obviously it depends on so many factors: in what environment you are, whether you're traveling, what is the social circumstance. You drink 1 liter of water and then obviously you will have to pee in half an hour. So how do you manage that if you're traveling, etc.? So water intake and thirst is a very relative thing. Usually our indicator is that don't depend on your thirst. There should be at least, as I said, 6 to 8 glasses of water consumption during the day. If you're out in the hot sun, and obviously your thirst will be much more, and you would probably end up consuming much more. But if you are sitting in an air-conditioned environment, you may go for 12 hours without drinking any water at all, because you may just not feel thirsty. So that's probably not a good thing. So in some ways, you need to be a little obsessive if you are indoors all the time, and ensure that you get trained to drink a glass of water every 2 hours, especially when you're awake. We don't encourage too much of water intake beyond 10 p.m. because that will again disturb your sleep, and that can become an issue. So usually 6 to 8 glasses of water during the daytime before you go to sleep is a good idea.
Doctor, let me ask you, how do you manage water? Because, I'm sure you have back-to-back patients, if not in the hospital, then you have your OPDs. So do you manage to take some time off to
Absolutely. So, in my outpatient clinic, there is always, there are 2 jugs of water and 2 bottles of water, which are always kept on my table. And, in between patients, I make sure that I stay well hydrated. And, obviously being a nephrologist, I'm a little bit obsessed about water intake. So I ensure that I take 6 to 8 glasses of water almost every day. And that, is something that we need to develop a habit of people who are not used to drinking. But I think that's a wise thing to do. Yes.
Perhaps in these days, you can just put an
alarm and just ensure that you take enough water.
Right. We have a question from Dibendu Ganguly, who says that he's 61. In a recent checkup, my EGFR was 81. Is that something to worry about?
Yeah. So how old are you, Mr. Kalia?
61.
61. So as I said, after the age of 40, the kidney function goes down by 1% every year. So if you are 61, I think you are dot on the line. Your kidney function is essentially normal. You don't need to be worried about it. But the general recommendation still stays that you should have a health checkup every year, every 2 years, to ensure that everything else is fine.
All right, thank you. So we have another question from Bridge Kalia. He says he is 77, well-controlled diabetes, had UTI 3 years back, and creatinine level went to 5.5. Was not told clearly if kidney is affected. The creatinine level now is 1.1 or 1.2. Please suggest do's and don'ts for what to eat and what not to. Special precautions to take care. And he asked, is it okay to take 1 liter of water every morning with or without lemon? Is that okay, or should I just sip over a period of time?
Right. So let's take the questions one by one. I think Big Kalia has also asked about, he had a UTI 3 years back, right, and his creatinine went up to 5.5. So clearly he had an acute kidney issue, and thankfully, I think with the right treatment, his kidney function has improved and it has come down to 1.1, 1.2, which is okay. Taking 1 liter of water early morning is okay, as long as you have a washroom close by. If you are going for a run or something and you don't have access to a washroom, that can become a problem. But with or without lemon is quite okay. Lemon is a good antioxidant and it will give you some vitamin C also. So no harm in taking lemon. And you can drink 1 liter of water at a time. There is no issue. But don't be excessive in terms of the total water intake. So as I said, up to 8 glasses is fine. Beyond 2.5 liters, unless and until you've had kidney stones in the past, where we encourage people to drink even more than 3 liters per day. Otherwise, you don't need to really exceed the 8 to 10 glasses per day.
Sorry, we have another question from Mr. Bridge Kalia, who says, I have an enlarged prostate problem and I'm taking Urimax D every night. There's urine dripping, especially in the morning hours when I take 1 liter of water early morning when I get up.
So probably what is happening is his bladder is getting over distended, and that's the reason why there is some dribbling that's happening. Even the prostate problem itself can sometimes lead to incontinence. So you need to be a little careful. I think he needs to consult the urologist who has been treating him with Urimax and just get evaluated once again. Just make sure that the prostate size is reasonably okay. And obviously prevent urine infections, because that is the biggest worry I would have with somebody who's got a prostate enlargement.
Doctor, I've got a question. Somebody sent me a message directly and says, can you ask doctor as to who should one go to? Should one go to a urologist or a nephrologist for kidney and urine related things? Because one doesn't really know, he says, which one to go to, who to go to.
Right. So urologists are the surgical kidney doctors. So they are the ones who operate for stones and prostate and even do our kidney transplants. And we nephrologists are the medical kidney doctors. So we look after people who got kidney failure. We do dialysis. We treat people with hypertension and diabetes and related kidney complications. We also deal with a lot of patients who've got urine infections and stones, etc. So sometimes it is a teamwork where a urologist and nephrologist would work together. But usually if you have a surgical problem, yes, you go to the urologist first. And if you have a medical problem, then you go to the nephrologist first.
Doctor, there's another question which I've got.
I'll just charge my laptop. 1 second.
Yeah, sure. So those of you who are here, we will, Dr. Kothari is going to be back in a minute. These are realities of life. You need to charge your laptop, you need to charge your phone, and I'm sure that extra bit of charging is critical. So as you all are aware, we are on our 2nd anniversary special. Yes, Dr. Kothari, we were talking about So there's this, the same person has asked a question. I'm 61 years old and I travel, I'm from Mumbai and I travel to South Mumbai every day. There are times when I do not find any restroom for almost an hour. Is it something that is dangerous?
Not really, not really. So, you modulate your water intake depending on, as I said, the social circumstance. And if there is no access, thankfully, nowadays we have a lot of five-star hotels. So just drive into the five-star hotel and use the washroom. No big deal about it. But in case you are not able to do that, or for some reason you don't want to do that, then restrict your water intake while you're traveling. Once you reach office or once you're at home, then obviously you can consume a little bit more water, so that obviously that's manageable socially. But no other reason to be worried about. Even if you don't drink water for 3 hours, it's okay. Yeah.
Right. We have a question from Katie Dadanji. Again, a lot of drinking, water, etc. question, but these are very basic. She asks, doctor, if you drink black tea or coffee 2 cups daily, can it substitute 2 glasses of water or not? Is it?
No. In fact, tea and coffee actually have some diuretic effect. So probably if you're consuming more tea or coffee, you will have to drink a little bit more, because obviously these drinks will lead to more urine output. So you will have to stay well hydrated. Tea and coffee cannot replace water intake. So you will have to stick to your 6 to 8 glasses of water per se. All the other liquids are extra probably, and that's what I would recommend. Yes.
Doctor, we have 2 more questions. This is from Usha Jacob. She says a relative had an enlarged prostate a couple of years back, but is very much under control under the previous years with regular exercises. Doctor has advised that there is no immediate need for surgery. Is it okay? Is it okay if it is monitored regularly, or is it compulsory to do surgery?
Absolutely not. I think Usha is spot on. All prostate patients do not require surgery. Prostate normally enlarges with age. So, everybody is going to have an enlarged prostate at the age of 90 if you look at it. And 70% of the enlarged prostates are usually benign. So it doesn't require any surgery. But being under supervision with a urologist, I think, is a advisable thing, because sometimes the prostate problem can lead to urinary complications and bladder complications, etc. So something that needs to be monitored, but surgery, most surgeons will be reluctant to operate unless and until it is absolutely required. So every prostate patient or enlarged prostate does not require surgery. So Usha is spot on. I think monitoring regularly is the key, and surgery is rarely required unless and until the prostate is so big that there is no passage of urine and there is obstruction, and that's where the surgery becomes mandatory.
Doctor, we have a question from Shrikant Kulkarni, who says they say beer is a good scavenger of the kidneys. Do you?
Okay, I read that, and I almost always get asked about about beer and alcohol. So it's all a misconception. Again, beer is a very strong diuretic, and it doesn't have any scavenging function on the kidney. So thinking of beer as a kidney protective agent is not correct. But an occasional beer is okay, as long as you are having moderate consumption, and again staying well hydrated, and otherwise if you are well, then it doesn't harm you. But no, there is no evidence that beer can actually help your kidneys. No, not at all.
Okay, thank you. Doctor, there's a question from a specific question from Dinesh Paliwal, who says 71 MUSG showing he's 71. Showed bilateral medical renal disease, PSA 0.5, creatinine 0.88 Ag, CR 3.94, prostate 24.8. Please suggest.
So I think rather than getting very generic, the overall profile seems to be quite okay. The bilateral medical renal disease is something that has been mentioned on the sonography, but doesn't mean that Mr. Dinesh has a kidney disease. As far as I can see, the PSA and creatinine are normal. So nothing much to be worried about. The prostate seems to be mildly enlarged, but something that again can be monitored, and you should see a urologist maybe once in 2 years and just keep a watch on that. But nothing alarming as far as I can see from this message.
Thank you very much, doctor. So just to recap, you're saying that one must get the checkups done once a year, which is creatinine and a urine routine.
Yeah, urine routine. Yes, absolutely.
Urine routine once a year. That's and also consult a physician with your annual checkups, and if necessary, meet a nephrologist or a urologist if necessary.
Absolutely.
Doctor, is there if one does want to do a teleconsult with you, is that a possibility that is available?
Of course. So I am currently still doing teleconsultations. In the peak of COVID, I was doing it almost every day, but now I've reduced it to twice a week. So I will send my email address and all the details to you, and anybody is welcome to consult with me. I'm physically available at Nanavati Max Hospital 5 days a week, and I still continue to visit Hinduja Hospital, Khar, once a week. So it's not very difficult to get hold of me. So no issues about that. Yeah.
Thank you very much, Dr. Kothari, for this session. This is apart from being our second anniversary, we've completed 2 years of the Health Live session. So it was a delight to have you here. I will just make one more announcement. Those of you who like to come for our Health Live sessions, and please let us know. We will have you on our database so that you don't have to wait for the announcement to happen. We will pre-register you, and you will get to know about whenever the session is there. The other major announcement is that the 8th season of Seniors Have Talent is going to start from August 17th. And those of you who have been through, who have seen what Seniors Have Talent is, it's the only of its kind talent contest, singing talent hunt for 60-plussers, for senior citizens. And we have done 7 seasons already, and over 500 contestants over these 7 seasons, which we've been doing since 2020. And our 8th season is going to start from August 17th. So those of you who are interested, we are, the link is there in the chat window. Please, you can participate. Please send it to others. Apart from everything, apart from the fact that there is a singing talent hunt, and those of who are good, it's also exceedingly therapeutic, and it's good fun. So you must participate. And thank you very much once again, Dr. Kothari, and thank you to the team at Nanavati for facilitating this. And we will be happy to connect with you once again, and have you respond to our questions the same way as you did today. Thank you very much.
Thank you, Mr. Maheshwari, and thank you for the entire group of seniors today. Thank you very much. Yeah. Good day.
Subscribe now and press the bell icon. Never miss an update.